Here's the picture for pericarditis. There's going to be a few things you're going to see when a patient comes in. You're going to, on the x-ray, there's going to be a water bottle in the chest radiograph, so water bottle appearance. You're going to get a friction rub. Pulsus paradoxus. See the two pair of docs down here? And they're checking for pulse. Pulsus paradoxus is a decrease in strength of the pulse during inspiration. You might actually get, I'll put it up here, a universal sign for fever. And a non-productive cough that often can happen, mainly because the causes of pericarditis, which is the inflammation of the pericardium, can be caused by viruses and bacteria. So one of the ways is bacteria. And you've got viruses. You got TB is one, Coxsackie-B, Coxsackie-B. Those all cause can cause pericarditis, and if the treatment, if it's a virus, is NSAIDs. Uremia, or chronic renal failure, is the treatment's dialysis when you've got pericarditis, but kind of help it out a little bit. But that can cause pericarditis. Ischemic heart disease. Things like SLE. Here's the woman with SLE. Joint pain and malar rash and fatigue. Treatment for that is steroids. Got rheumatoid arthritis. And we got the swan here because they have swan neck deformities, but that's when you go into RA. Dressler syndrome, which is an autoimmune reaction after an MI, so Dressler's. And you also have meds like daunorubicin, or I call it Dan, but it's daunorubicin. And it's discontinuing that to take care of it. You're going to get, so let's go. You're going to have a pericardial high pitch friction rub. The patient's going to want to lean forward. That relieves a lot of pain for them. So in acute pericarditis, it mimics a lot of right heart failure, like tapenade. You've got an increase in jugular venous pressure, which is the extension of the neck veins. You've got the pulsus paradoxus, which we went over. And you've also got a Kussmaul sign, which is an increase in JVP, which is jugular venous pressure with inspiration. So pay attention to that. Chronic pericarditis causes constrictive pericarditis, which causes right and left heart failure signs and symptoms. In addition to what we just talked about, you've got things like dyspnea, weakness, fatigue. On the EKG, you're going to see an ST elevation, so that's what we're looking at. Now, the difference between when you've got pericarditis and an MI is they both have ST elevation, but pericarditis will not have any cardiac enzymes. So MI is going to have the CKMB or the troponin, but pericarditis will not. Also, the ST elevation is a little different. In pericarditis, the T waves might invert after the ST is normal, but in an MI, the T waves invert during the ST elevation. So, but there's no changes in the QRS complex. So these are all things that kind of cause pericarditis, how it looks, and how it presents.